Welcome to today's episode of Mindful Medicine. I'm your host, Tracy Jones, and today we have special guests with us. We have Sue and Ginger, also known as the Reiki Sisters. Hi, guys.
Hi.
How are you all?
Good.
Good.
Great.
Well, thank you for being here with us today.
Yes.
I have some questions. Could you tell me a little bit about yourselves?
Well, we're both research scientists for, I guess, a combined total of 80 years.
80 years?
Yes.
If you put both of our research
Times
together, yeah, 80 years.
Wow.
So we've done a lot in that field, and fortunately for us now, it led us to be able to do stuff with Reiki that we never even knew was possible.
What kind of things do you do with Reiki?
We have been successful in helping people who in pain get off of it, and it's really amazing because for us, there's no drug interactions or necessity for a client to change anything they're doing with their medical personnel. It just gives them a way to possibly have increased ability to have decreased pain without taking an additional drug of any kind. And it is also no side effects from the energy, and it seems to be working quite well.
Great. So if somebody comes to you and they do struggle with a lot of pain and they may be on pain medicines to help, typically how many sessions does it take? And I'm sure it's different for each person, but is there an average that you kind of see sometimes?
We have seen in one session, we've seen people who were struggling even with everyday movement get off the table and that evening go out dancing in one session. We've had others who have taken several sessions, but they were on a lot of medication for rheumatoid arthritis and different things, and through probably within a month with a session every week, their numbers for rheumatoid arthritis clinically have decreased, even gone away.
Really?
And they've been able to stop taking that medication. So it varies, like you said, from person to person, but we've had success in one session, and for really long term, the longer they've dealt with it, the more severe it is, the longer it's taken. But within 1 to 2 months, we've had great success with people with that.
Wonderful. And once they are seeing their numbers get better, even in their blood tests and things like that, do you typically recommend they come back for
Yes.
maintenance?
Yes.
Yes, sir.
We sometimes in the beginning we have to treat people often, sometimes maybe 30 days in a row. This was especially true with people who were helping off of opioids, because there's so many complications when you're decreasing a drug on top of having perhaps an autoimmune problem. But as that went on for this particular person, we're down to once a week, and she stays in quite good condition.
Well, let me ask you this, because you said 30 days in a row. Are they coming to your office 30 days in a row, or how
No,
are you doing that?
We do an awful lot of our treatments remotely. And this particular person I'm talking about is in Texas, but we treat people in Texas, in Florida, in Michigan, in Arizona, and we've treated them in Asia and Russia, all kinds of places. So.
Wow. So how do you treat them remotely? Is it a phone call? Is it, what do you do?
Actually, we've talked to them. People actually have reached out to us because of our background and because we did Chinese herbal medicine, and they have a particular problem and they're looking to us to see if we can offer that to them. Well, at this stage, we don't have that available, and we just let them know that's not, we can't help them in that, but have they heard of Reiki? And some are like, no, what is that? And so we just describe it and go ahead with setting up a session. And every time we've done it that way, they've had success and keep coming back. And this has happened in more than one occasion where people came to us for Chinese medicine and ended up with Reiki, and it's been a long-term relationship remotely. So we don't use a phone, we don't use video. We talk to them ahead of time. We set a time for them, explain what we'd like them to do, relax, have water handy, and so we send it for, like 10, 15 minutes, and usually they fall asleep.
Wow,
So
amazing.
we've set up many long-term things that way. People call us in a crisis,
Mm-hmm.
and so we're usually a 24-hour call. It's happened quite a few times that way.
Wow, so it doesn't have to happen in the actual
No.
office, although you do have an office
we do.
here
And
downstairs.
we have treated people there, but it is interesting because people who have, let's call it an acute or immediate injury, like they sprain their ankle or something, it can be fixed in 10, 15 minutes. And people who have chronic problems, perhaps some kind of autoimmune disease, need a little bit more. It seems to us that the longer you've had a problem, the more it takes to have it go away. But at least it helps in controlling pain and discomfort.
Wonderful.
We had a client from Michigan who, in the middle of the night, sent a text, "I need a miracle." She was in an ambulance on her way to the hospital with major heart issue.
Mm.
And so we're like, we're on it, and so then we send it then, and once we set the intention for it, it continues. So the whole time she was in ICU and everything, it was just anytime you thought about it, you sent. And she was a miracle.
Wow, that is wonderful.
So, I mean, we are just thrilled at this point to be able to help people that way. I mean, since we did retire and then went out of retirement and now
Right.
doing this, but it is absolutely rewarding to be able to help people with that.
And I think it's wonderful because you mentioned you both have a scientific background.
Yes.
And now you're into Reiki and energy work. So obviously with your scientific minds, you are seeing
Yes.
results because is it both of you have been published in
Yes,
the past,
yes.
correct?
Yes.
I have over
Yeah.
100 papers.
I have about 60
So-
publications, yeah.
So you know it works.
Yes.
You've seen it works. You've seen the
Yes.
actual scientific data.
Yes,
Well,
we have. We've
yes.
seen the proof.
Be
yeah.
perfectly honest, I have no idea how it works, and that is a bit of a problem for my scientific mind, but because I am one of the people transmitting the energy, I see it working, so I've accepted it.
I do know that scientifically a lot of this is being proven. They're able to measure the energy, they're able to measure the change.
Mm-hmm.
And so in terms of the scientific mind, some of that is satisfied. But there was a major leap of faith when we started.
Yeah.
And
Right.
it was like, okay, I just got to believe what you're telling me. And it did take a while, but to be able to feel what I feel now, and the more you pay attention to what you're feeling and what you're sensing, it just grows.
Right.
And so in terms of our practice, we've seen a lot more because of believing in it. And I believe that the people that come to us need to have a little bit of faith too, that this is going to work.
Right. Right. They have to be open.
Yes,
to
they have
healing.
to be open.
Mm-hmm. So if somebody wants to schedule an appointment with you all, of course they can go to our website
Activity,
and
yes.
find you all there. But is there any other ways that they can
Yes.
reach out?
They can just use our phone numbers, which are on our business card and probably are provided in the
On the website,
department
yeah.
website.
And
yeah.
we do have a website that kind of describes our background
Mhm.
and Reiki in general, and
Okay.
all the, different testimonials from people who have been helped.
And what is that website address?
It is Reiki Sisters Healing Hands. It's www, but Reiki Sister Healing Hands.com.
.com. So they can go to www.reikisistershealinghands.com. Is
Yes,
that correct?
That's correct.
Well, wonderful. Thank you both for being here with us today.
Thank you.
It's our pleasure. Thank you.
And thank you for watching this episode of Mindful Medicine. And remember, you are loved.